Oh no, this is down to like 32 minutes. That's not good. Okay. Yeah, the battery. But I'll do what I can do. Okay. So we'll move right along. I've got 6 minutes to finish. Yay! All right. Let's see. We're going to talk about opiates. And so if we remember our 4 quadrants of substances, opiates is what? What do opiates do?
Oh, I don't remember.
They release the chemical that makes you feel happy. Opioids. Something like that.
Yes. Thank you, nice. Opioids are painkillers. Opioids are, anytime you hear the word opiate, it's referring to a painkiller. So we're going to jump into that and look at the effects of opiates. And so, what do you notice about these pictures here? What are these pictures of?
Poppies.
Yeah, poppies. Where do a lot of poppies grow? In the world.
Mexico.
Mexico?
I said South America. Is it South America?
South America?
Oh.
There are actually a lot of poppies that grow around the Afghanistan area. Where the chemicals that make up the opioids, are all derived from the poppy plant. The chemicals that are found in, and actually folks have known about the power that's invested in, or that's in that poppy seed, in those poppy plants for a long, long time. We have Roman inscriptions of Roman doctors using and prescribing the poppy plant for things such as diarrhea, dysentery, for headache, for nausea, for cough. We have actually preserved writings where folks are using the poppy plant to treat some of these illnesses. And so if you look, and you look at this poppy plant here, someone has taken something and sliced open the bulb. That resin up there is actually used to produce raw opium. So when folks are manufacturing opium and heroin, this is some of the process that they're going through. So I wouldn't show this to your teens because you wouldn't want them to know how to derive opium from the poppy plant. This is for those that are in the field. The alcohol stuff they need to know, but let's keep this amongst ourselves. So inside poppy plant, the seeping gum is scraped off, then dried to produce raw opium. So if a person were to smoke that substance, they would get the neurological effects, the physical effects of them being high on opium. Examples of use in history, that's from a previous text. Like I just explained it. I mean, it's been around for a long time. We've known about it for a long time. The Greeks used it for recreational use. There's some poppy extracts with opiate actions that have been found in the area of Samaria and Middle East and judged to date from 4000 BC. So, we're talking about 6,000 years ago. Cultures recognized, there's something going on with this. And so, if somebody gets in a bad car accident and their leg is broken, what do they give them in the hospital? Yeah, morphine.
Painkiller.
Painkillers, yes, the opiates. We still use this. 6,000 years later, we're still using it. We haven't found many things better. We've come up with some synthetics, but the synthetics chemically are based upon the chemical compounds. Morphine is absolutely an opiate, and we'll get into classifying those in just a little bit. And so here's a picture of an opium den. Opium in Afghanistan, it's a big export, the poppy seed and opium there. You know, they used to have the anti-drug commercial where they'd come on, you know, maybe 10, 12 years ago, and they say, if you're buying drugs, you're supporting terrorism. And so, you know, they tried to equate that to marijuana. You know, I have a hard time buying that with marijuana. I don't have a hard time buying it if you're talking about opium. Possibly. I mean, there's greater chance of opium being imported. So here is a brain. Now, this is actually a gerbil's brain, but they've ingested this gerbil with heroin. And what part of the brain? And heroin is an opiate. It's an opioid. If you look at the list, the way that those break down, what part of this brain is most affected? Well, excuse me, is opium. My bad. Which part of the brain is most affected by opium?
Will be the part that deals with pain.
Yes. And so we're not talking about a whole lot of the gerbil's cortex. Not talking so much about the cortex. Talking more about, again, these lower reptilian brainstem type functions. So when a person takes well, I'd say, what can we infer about mechanisms of action based upon this image? When a person takes morphine or an opiate, what are the effects in that person?
Well, it slows like your heart rate down, and those type of things in the brainstem. And it's kind of opposite of the alcohol that you explained to us, because it affects it looks like from the inside out.
Thank you.
As opposed to the outside in for the
nice
alcohol.
Comparison, absolutely. It slows your heartbeat. It slows your respiration. A lot of effects are here on, again, a very primal level. We really started to synthesize here in the United States. We really started to synthesize opium into different substances with our laboratories around the time of the Civil War. There became to be known soldier's disease about the time of the Civil War. If anybody recognize what this is here? This is actually...
Is that a syringe?
Thank you, Nines. Absolutely. This is actually a very rudimentary, old syringe. And so what happened was, about the time of the Civil War, our technology through medicine came up with the syringe to be able to deliver medicines intravenously. And so one of the first medicines that they found out about its potency was morphine. And so when you had somebody that had soldier's disease, these were people that had been injured in the Civil War and then became addicted to morphine. So that's what soldier's disease referred to. So it's been around a while. Did you know, just like Coca-Cola, who knows where the name Coca-Cola came from? Yeah, Lauren tipped us off on that one. It's Coca-Cola because it had cocaine in it, the coca leaf. So cocaine was at one time legal in the United States. That's actually the original Coke. Sorry, the old reference with my generation there says they had the new Coke. And then we actually used to have Bayer. What is Bayer famous for manufacturing? Yes, Bayer. Give me a Bayer aspirin. Well, this is Bayer heroin. Heroin was legal in the United States. And the reason why heroin was legal is because they made the argument for a few years that, well, heroin is safer than morphine because we have all these soldiers that are addicted. Heroin doesn't have those properties. Well, like the pharmaceutical companies today that are being sued because they have all these bad effects with people, the same thing, you know, sometimes history repeats itself. Obviously, heroin was not safer. Heroin is actually more potent than morphine. There is a chemical property in heroin that is not in morphine that crosses the blood-brain barrier. So whereas you don't have as pronounced as you don't have the hallucinations with morphine, you do have some psychological effects, but you have some very significant psychological and hallucinatory effects with heroin because part of it crosses the blood-brain barrier and it affects more of our sensory parts of the brain. So you can see it was prescribed for cough. It's actually very effective for cough. You know, anybody had cough syrup with codeine? Yes, that's an opiate. They put an opiate in your cough syrup still because it will depress your urge to cough. It's been a very effective substance. And they affect your opioid receptors, your pain receptors. Here's some more. I preferred to drink Coca-Cola. It relieves exhaustion. and cocaine tooth drops. Who here's ever had Novocaine at the dentist? Yeah? What does Novocaine do? Yeah, it makes you numb. Novocaine, cocaine, that chemical property that's worked in Novocaine works in cocaine too. It's an topical analgesic. It numbs things out. This Vin Mariana. It actually had cocaine in it. Good for body, brain, and nerves. And look who's advocating. It's is that the Pope over there? Who's yeah, the Pope's advocating this. So talk about a spokesperson.
Oh,
Well, we all know about Freud.
Did he know though?
What's that, Knight?
Did he know what was inside of it?
Well, the thing of it is that was the culture. You know, that's.
Oh yeah.
It's important to recognize how our cultures change, but sometimes they stay the same. I mean, that's a good thing. Freud he prescribed it to his patients. Freud was like, he has writings about how great it is. And, well, Freud, you know, and Freud got off on the sexual tangent. I don't see that as being a complete, you know, dopamine's released with cocaine, so it's released with sex. And there's a reason why he got off on sex on his theories. So, I was making frequent use of cocaine at that time. I had been the first to recommend the use of cocaine in 1885.
Wow.
And this recommendation had brought some serious reproaches on me. That was in the interpretation of dreams. So he did like his cocaine.
With that kind of, I mean, when he's using that kind of substance and then he comes up with these theories, it makes you really wonder how accurate some of those things are, especially when you know the effect of those substances on the brain.
It's a funny thing, Nice. He is uncannily, because what cocaine does is it's a stimulant, and it actually does stimulate thought. I mean, it's like a really, really strong cup of coffee times 20. And so it stimulates thought. After too much, though, you start to get really paranoid and start to lose that rationality that a person may have had when they, you know, a little bit of it. You know, what do they give kiddos for ADHD?
stimulants.
Yes, they give kiddos stimulants for ADHD. They give them Ritalin, Adderall. Those are amphetamine salts. And so they give them this low dose, this quick acting dose, and wow, I can focus on my schoolwork. Yeah, it's increasing your mental capacity to a degree. So I'm not going to throw Freud completely out, but he, you know, he got off on some tangents that were a little bit sketchy. Hopefully we're not all id-driven. Different kinds of opiates. I probably should have given these first, but this will help you. This will help you in your drug recognition. If you have clients come in and say that, and I would say that's an important thing to have as a counselor, is to have like a physician's desk reference or nurse's desk reference where you have, you know, a list of medications. And I'll prescribe, and I'll give a sheet that has very common ones on it out as a resource as we go along. But here's some different kinds of opiates here. A lot of these are painkillers. These are widely abused. These are widely abused. And so here's your effects. Analgesia, euphoria, sedation, depression of respiration. If you take this with another substance like alcohol, it will have an additive effect. Both will work more strongly. It's very dangerous to mix substances. Or even if a person takes, I mean, there's a lot of people out there now that just try to do whatever they get their hands on. A lot of people that are dealing with addiction. And so they'll drink alcohol, they'll take a couple of Lortabs, and then I'll take a Xanax on top of that. So you've got 3 different classifications of 3 different kinds of chemicals. But all those are going to be additive, and that can be dangerous. When you look at people that overdose and they go and do a toxicology report, many times they'll have many different substances. If you look at Austin Box from Enid, Oklahoma, and you look at the substances that were in his system, you know, accidental overdose, there's additive effects, and people have to be very, very careful. Suppression of cough. Is a good way to know if somebody's intoxicated in your office. If you suspect that they're on pills, or on morphine, heroin, take a look at their pupils. We're dealing with stuff that's shutting down or slowing down your central nervous system. Their pupils will be pinpoints. They're not letting in a whole lot of light. And so there'll be really tiny little black dots in their eyes. And that'll give you a good hint that, you know, that person might be on something. Especially if they're lethargic and, yeah, man, everything's fine, you know. You know, you're going to want to, if it walks like a duck, it quacks like a duck. Pupillary constriction, nausea and vomiting, constipation and dehydration, releases histamine, can cause itching and asthma. And so actually the opiates categorically have the worst withdrawal symptoms of all of our 4 classifications of substances. People will typically have fever, chills, they may be panting, they'll have some muscle cramping, definitely some abdominal cramping, they can have some explosive diarrhea, we talked about that the first night, intense aches and pains. When people, you know, you hear about heroin addicts that go to a methadone clinic. What is for those of you that know, what is methadone?
I'm not really sure. I just know that they give it in place of to addicts that are trying to break their addiction. But
Yes, absolutely.
But I don't know, you know, there's obviously a difference between it and heroin, I just don't.
Methadone is an opiate, and so if a person does methadone, it will break that craving. It has some milder effects on the body. It still exerts some opiate-like effects, but it doesn't have the pronounced effect that heroin does. And so there's some debate whether you're just replacing addiction. If you're just giving somebody methadone, are you really getting them off heroin? What it does do is it helps a person cope with the withdrawal.
Do they decrease the amounts?
They should be. That's the theory, is to wean them off. Kind of like Sonia had said earlier.
So they decrease the amounts of methadone?
That's what they try to do. But one of the things that makes this a horrible, horrible withdrawal, cocaine and meth addicts, eventually they're going to go to sleep and they're not going to be looking for their drug. You're going to be unable to sleep coming off of opiates. So typically people will strive to get more of the substance, get more. Increased sensitivity to pain, general malaise, restlessness, craving, sweating, extreme anxiety. Again, these are some of the worst withdrawal symptoms, the worst withdrawal symptoms of any category. They also, when you're looking at tolerance, these substances have one of the quickest and most pervasive tolerances. Why is that? Why would you say that painkillers have a quick tolerance?
Well, is it because they bring relief? Like, if it like suppresses or whatever the pain, or it alters those pain receptors, I don't know, and calms everything down.
Why is pain important, Sonia? Pain is...
Because it... Wait, no, please say what you're going to say.
Oh, okay. Pain is a very important sensation for a human to have. If this is a hot stove, and I'm just sitting here talking, and what's that burning in here? Lauren, you smell it? Oh my gosh, what is it? No, pain in our survival, pain is very important for us to feel. We need to feel pain, because if we don't have our boundaries and our limits. I know that I can't go to that door and slam it and keep my hand in the door, because I'm not going to be able to use my hand anymore. We know that relatively early on. If you look at my little 19, 20-month-old running around, he's learned to take it easy in some spots because he's fallen, or that hurts. I know to stay away from that. That's hot. We try to teach people what their limits are. So we get a very rapid response biologically, and I believe this to be genetically determined, because we have to feel pain to navigate our world safely. Pain is important. People that become dependent, their goal is oftentimes to avoid negative withdrawal symptoms, need the drug just to feel normal. I've met a guy that used to take 18 Lortabs a day, and I was like, wow, that's just amazing. But he had that tolerance. He'd go. He wasn't employed, but he wasn't dead either. So he's just needing this to function. Not able to benefit from analgesia if you do not have a problem. I don't know what I was going for there. One of the problems here, if let's say that he gets in a car accident and then needs some opiates, and they give him some painkillers, are those going to work? No, he's going to have a tolerance, and so he's going to be in some pain. Long-term use, you do have neural pruning with this. You do have brain damage, and especially with something like heroin, I would note some chromosome damage as well. Brain mechanisms involved: the opioid receptors, spinal cord, brainstem, have substantial brain reactivity, like we saw in the neural image. So here are some treatment considerations for folks that are on morphine or abusing opiates. Number one goal is safe detox. There's a new drug called naloxone. It's a morphine antagonist. So if somebody then takes the drug's not going to work on them. Medication-assisted treatment. There's another naloxone. These are all basically substitutes like methadone. I would suggest somebody that's coming off of hardcore opiate use going to rehab, because these are very, very addictive substances. Again, giving some education, getting out of that environment where they're in. Any questions about, I know I went over that quickly, but any questions about opiates? Okay, let's see what we've got left. I may have been overzealous in what I wanted to cover today. We won't get to addictions and family counseling. That'll be what we'll begin with next time. These next two will be pretty quick. Let me check the recording. It's probably not going, it's blinking.